Good day, everyone. Today we're going to talk about the case 20 in this year about a newborn girl with hypotension, coagulopathy, anemia, and hyperbilirubinemia. So, how the infant born? She was born by cesarean section to a 3 years old prima gravida mother at 34 weeks 6 days of gestation. The weight was 2.15 and the head circumference was 31.5 centimeters. The length was 46 centimeters. Now we have a video about the babies.
Sepsis. Infection is the leading cause of newborn deaths. It can enter the baby during the birth process, come through on unclean umbilical cord or skin pustules. Infection can spread fast and affect the whole baby's body, leading quickly to death. This generalized infection is called sepsis. There can be multiple signs of sepsis and they can be subtle. Pay close attention to a mother's concerns. Babies with serious illness often do not have specific signs. This video will show how to evaluate and treat the baby with sepsis. Before checking the baby, wash your hands and the thermometer. As you take the baby's temperature, gather important background information. Has the mother herself been sick or has a fever? Did her waters break early? Did she have any problems with her labor or birth? Ask about key danger signs such as poor feeding, lethargy, and convulsions. Has the baby had vomiting or diarrhea? The mother reports that he is very irritable and is not feeding as often as usual. The temperature is normal. Check the baby. Observe his irritability. His eyelids and hands are swollen. Check the baby from head to toe for other danger signs. Look for jaundice. Observe the chest for indrawing and fast breathing. See, the abdomen is very distended. Check the umbilicus and the skin. This baby has multiple signs that point to sepsis. Irritability, swelling, poor feeding, and abdominal distension. Here are examples of other babies with danger signs that point to sepsis. This baby is lethargic. He cannot be aroused, even with stimulation. This baby has a severe skin infection and poor feeding. Here is a baby with convulsions and lethargy. This baby is lethargic. He doesn't react to stimulation. He also has poor feeding. This baby has severe jaundice and lethargy. Discuss the baby's urgent condition with the mother and advise her to take the baby to a higher level facility. Before the baby leaves, give the first doses of antibiotics. The baby will need intramuscular injections of ampicillin and gentamicin. Notify the facility, write a referral note, and arrange transportation. Make sure the baby has breast or cup fed and is warm through skin-to-skin contact throughout the trip. Every effort should be made to refer the baby. If referral is not possible, do your best to care for the baby in your clinic, though realize that this care is not the same. Give intramuscular gentamicin plus ampicillin or procaine penicillin. Procaine penicillin has the advantage of being given once daily. If there is no improvement after 2 days, switch from ampicillin to ceftriaxone. Keep the baby warm and fed every 2 to 3 hours. Treat the baby for 10 days. Discharge the baby when she is feeding well and there are no other problems. Remember, signs of serious illness in a baby can be subtle. Know the key danger signs: breathing problems, lethargy, poor feeding, abnormal body temperature, jaundice, and convulsions. Take action and refer these babies urgently.
Well, that was a strong video about the sepsis of a baby. Well, returning to the case, what was the treatment of the baby? The standard dose of vitamin K was administered shortly after birth. Supplemental oxygen through a nasal cannula and bolus of normal saline and dextrose were administered without improvement. Blood culture was performed and ampicillin and gentamicin were administered 1 or 2 hours after birth. Dopamine was administered intravenously. So, remember that the baby of this case had many diseases. One of those was the anemia.
I'm Stacy Tisdale for Howdini. If you feel tired all of the time, and maybe more than staying up too late and working too hard, you could be suffering from anemia, a condition that is especially common among women. Mary Bolster is editor-in-chief of Natural Health magazine. Mary, welcome.
Thank you, Stacy. It's really nice to be here.
So many of us just feel like this all the time. What is anemia?
Well, anemia is pretty pure and simple. It's an iron deficiency in the blood.
And what are some of the symptoms?
Well, you mentioned the most important one, which is fatigue. And it's usually a fatigue that happens when you're getting enough sleep. So it's not staying up late and working long hours. It's getting a lot of sleep and still feeling fatigued. Another thing is stress, kind of having an abnormal reaction to stressful situations where your stress levels feel really high. Pale, your skin gets pale because there's not enough blood, not enough oxygen in your blood, so that makes your skin pale. Being really unfocused, so feeling very scattered. And then another thing, which doesn't happen in every case, and it's kind of odd, but it's a craving to chew.
A lot of us feel like this all of the time. How can we go about finding out if it's anemia?
Well, you know, the fatigue is really the biggest part of it, and sometimes the fatigue becomes so extreme that you feel weak and you feel faint, and that's really when you have to get yourself to a doctor, and you need to get a blood test, which measures the hemoglobin and the hematocrit and the levels of your red blood cells. And those are the things you get tested. If those numbers are low, you have anemia. But it's really kind of a fatigue that's so strong that you feel weak most of the time.
Is this a serious medical condition?
Well, the problem is if it goes unchecked, it can become very serious. It can actually feel like a heart attack, where you have rapid breathing, an irregular heartbeat, and chest pain. So some people are rushed to the emergency room thinking they're suffering from a heart attack, and they're actually just anemic. So it can be very serious if you don't take care of it.
Now, I know you say there's a lot of ways to address anemia naturally, and one of your recommendations is to take supplements.
The two easiest things to do is take iron supplements. That's what you have to do first off before you do anything to your diet or to your lifestyle. You've got to start taking iron supplements. The second thing you do is you start to bring in iron-rich foods into your diet. From there, there's some other more specific things you can do. You can try acupuncture, which helps move stagnant blood. You can You have to exercise with care because sometimes over-exercising can exacerbate anemia. So if you're a fairly athletic person who exercises a lot, you really want to kind of you want to check that.
Energy drinks, you say, can also help us feel better.
Oh yeah, there's these energy drinks that sort of are high in algae-based. They're not like sports drinks that I think most people can think of when they hear the word energy drinks. These are sort of more specific high iron energy drinks.
And also you say that we can eat iron-rich foods.
Yeah, there's there's a lot of great iron-rich foods. Most people think of liver when they are told that they're anemic. They think, oh my God, I'm going to have to go home and start drinking liver shakes. No, you don't have to do that. There's a lot of more palatable foods that you can eat that are higher in iron, like clams. I don't know that everybody loves clams, but there's clams, there's oysters, soybeans, tomato puree, prune juice. Now that might be a liver equivalent on some people's lists. A lot of meats are very lean meats that they have a lot of iron in them. Another thing you can do is cook in an iron skillet because that imparts iron to your system. So that's another thing that people who have anemia are told to do is start using an iron skillet.
Great advice. Mary Bolster, Editor-in-Chief of Natural Health Magazine. Thank you for joining us.
Now, for the baby, we have to think about the mother. So, what is the family story? The patient's mother had a history of genital herpes and had been treated during the pregnancy with valacyclovir. She had received prenatal care and was immune to rubella. Her ABO blood type was O, Rh positive, and screening for antibodies to red cells was negative. She reported no history of alcohol, tobacco, or illicit drugs. She had emigrated from Eastern Europe 12 years early, lived with the infant father, and worked in an office.
The excitement starts when you hear the great news. You're having a baby. But now it's time to focus on you and your baby and keeping you both healthy. Dr. Jill can fill us in on some pregnancy no-nos, and more importantly, why are they even no-nos?
Indeed.
Yeah, okay, so let's first talk about why. There's a whole slew of things that you're told when you get pregnant. You can't have this, you can't have this. Why? What is the difference now?
Well, now, after years of experience, we know that those certain things can have bad effects on the baby or the mother.
Right, but some of those things our parents did, and they said, oh, it was fine. You turned out fine. Look, you look okay.
A good example of that would be having the baby sleep face down.
Right.
I slept face down for years and nothing happened, but later on proved that it actually is bad to sleep face down.
Okay, so let's go through some of these things. First of all, let's talk about alcohol, which is pretty self-explanatory, but alcohol and cigarettes. Some people in different countries have a glass of wine a day, even when they're pregnant. We are told in the United States, no, completely stay away from it. Why?
Well, the main reason is fetal alcohol syndrome, and it can affect the baby. We actually don't know exactly how much alcohol can do that, so that's why we just say really hold off on it. And we actually used to use alcohol to stop labor. And we would inject moms with alcohol to kind of get their uterus to quiet down.
Really?
And then obviously we found this association with fetal alcohol syndrome and we stopped.
Okay, but is one glass of alcohol every once in a while, once a month, okay? We're talking a glass of wine or something?
I would never tell someone to go have a glass of wine, but I think if someone told me that they had one, I'd probably offer them some reassurance. It's probably not going to do that much harm.
All right, but try to abstain if you can.
Try to abstain.
And cigarettes?
Cigarettes are interesting. Obviously, we know cigarettes hurt the mother terribly. It can lead to lung cancer and all the bad effects. But for babies, it actually has a direct effect. I mean, when you take an inhale, basically the vessels in your body kind of spasm a little bit. And so the blood flow that goes to the baby can be compromised. So babies that have smoking moms they can be a little jitterier after they're born. They can be smaller, so growth is a big issue.
Okay.
So it really does some direct harm to babies to smoke.
Okay, so absolutely stay away from smoking.
I encourage them to please stop.
Let's go to something a little bit more subtle. We hear caffeine.
Yes.
Caffeine, stay away from.
Right.
Can you have a cup of coffee a day when you're pregnant?
I tell my patients it's fairly safe to have a cup of coffee every day during pregnancy.
Just don't drink a pot.
Just don't drink an entire pot. Have a little bit of caffeine if that's what you feel that you need, because sometimes if you withdraw from it, you can get headaches and other bad
Sure.
things. So again, I wouldn't advocate drinking it, but if you need it, I don't think it's going to be too terrible.
And what kind of effect will it have on a child, a
Well,
baby?
actually, caffeine raises your blood pressure. So again, as you raise your blood pressure, the blood flow to the baby is a little bit compromised. So same sort, that's why high blood pressure in pregnancy can be so dangerous.
Okay.
So, and caffeine can attribute it to that.
All right. What about unpasteurized cheese? We're told to stay away from some fromage if it's not pasteurized.
Exactly, and that's related to a bug called Listeria. But I will tell you, in my experience in the last 12 years of practicing medicine, I have yet to see one case of Listeria.
Really?
I still would tell people, please stay away from the soft cheeses, but every once in a while, again, it probably is not too bad. It's a rare thing.
Okay, and finally, we don't have to completely abstain from exercising. It would actually be good to work out, you know, to keep ourselves in shape, but just nothing too intense, correct?
Right. I think whatever you were doing before you were pregnant, you should continue to do while you were pregnant. Exercise is the best thing for you. Just make sure your heart rate doesn't go above 120.
Okay.
Then you know you're not compromising the baby.
So wear a heart rate monitor at all times when you're exercising
Absolutely.
and you're pregnant. Dr. Jill, always a pleasure to have you here.
Thank
Thanks
you.
so much. All right, we'll be right back. Don't go anywhere.
Well, that was a video about what a mother pregnant must not do during the pregnancy. So, continue with the case. An acute neonatal illness and liver failure without evidence of acute inflammation might indicate a congenital metabolic disorder. Inborn errors of metabolites can be divided in two groups. The first group is characterized by multi-organ failure and clinical collapse and is associated with major metabolic disturbance, such as acidosis, alkalosis, and hyperammonemia. The second group is characterized by liver failure as a leading clinical symptoms and includes metabolic disorders, such as galactosemia and hereditary fructose intolerance, type 1 tyrosinemia, and mitochondrial respiratory change disorders. Now we have another video.
Hypotension is just as serious a problem as a very high blood pressure. In general, low blood pressure can be thought of as a rate, pump, or volume problem. As mentioned previously, bradycardia or tachycardia can cause a decrease in the blood pressure. Problems with the pump, that is the heart function, may be things such as a myocardial infarction or cardiogenic shock, causing low blood pressure. Other conditions such as hypothermia or cardiac depressant medications can cause low blood pressure by affecting the pump. Perhaps the most common etiology of low blood pressure encountered clinically would be volume problems from things such as hypovolemic shock, severe dehydration, hemorrhage, or septic shock. Anaphylaxis and neurogenic shock from spinal cord injury are reasonably common causes of low blood pressure. Low blood pressure should be evaluated and treated urgently. An assessment of a low blood pressure should include a recheck of the pressure and close monitoring. If a client has recently changed positions, they should be returned to a supine position and rechecked in a few minutes. Orthostasis literally means standing upright. Orthostatic hypotension is defined as a decrease in systolic blood pressure of at least 20 millimeters of mercury or at least 10 millimeters of mercury diastolic within 3 minutes of a patient standing. If orthostatic hypotension is encountered, then the client is at risk for falls and should be closely supervised with ambulation or advised to call for assistance with activity. To test for orthostatic hypotension, take the blood pressure whilst the patient is supine and at rest. Then stand the patient, and they must be able to stand for 3 minutes before taking the blood pressure again. If the measurements meet the criteria stated previously, then orthostatic hypotension is evident. If the result is equivocal, record that and request a formal assessment.
And in conclusion, This is not a very common pathology, but we have to consider the habits of the mother. The treatment for this baby will be hard because she's a newborn, and not all the functions are working well because she's a newborn. And the final video.
Dr. Paul here. We have a case of hyperbilirubinemia which causes jaundice in newborns. This is a young child who had a bilirubin that hit 22 on day 9. And this is our follow-up, day 12. Let's go take a look.
Hello.
And this is called the Butani nomogram. And this is bilirubin levels of 5, 10, 15, 20. And this is your hours of age. So when he was in the hospital, it started off at 24 hours at 6.7, which is just barely in the high intermediate risk. It went right to about between low and high intermediate at 10, a bilirubin. And then you went home and everything was going fine.
Yep.
And this actually, my chart doesn't go off far enough, but day 9, we were at 22.
Yep.
And that's definitely in the high risk zone. Not good. When you have bilirubin in the high 20s for about 3 weeks, it can cause problems with brain. You probably know that's why we worry.
Yeah, exactly.
So obviously, we don't want to take chances with brain. Okay, buddy. There's those eyes. There we go. Sometimes the up and down will get the eyes to open. They're just a tiny hint of yellow.
Yeah.
I'm fairly reassured that this bilirubin's going to come back about the same as it was in the hospital, the 14.
Okay.
And that would be fine.
Okay.
I want it to be lower. If it's way higher, we're going to get aggressive again with phototherapy because, again, it's that high over time that we don't want. Hi, it's okay. Now, looking at the skin, folks, this is just a hint of yellow in a normal, little babies are pink. Oh, baby, it's okay. I know, it's okay. Yeah, I know. So we have a hint of yellow here on the face and chest, but really not that bad. We'll warm the heel, check his bilirubin, and take it from there. And if it's gone back up, we're going to start the phototherapy again and really push harder on the feeds. We have got to flush this bilirubin out to protect the brain. If the bilirubin's slightly higher, we can do phototherapy at home. It's called a wallaby blanket, and that's a lot easier than going back to the hospital. So we sent the blood to the hospital for the bilirubin and the results are back. I'm going to call the parents. Hi, it's Dr. Thomas. Yeah, we got the bilirubin result back and it was 17.8. I was sort of hoping it would be a little bit lower, so we definitely need to get the phototherapy going again. We're going to have a company come out to the house, set you all up so you can do phototherapy at home, and then feed. I would highly recommend go ahead and supplement. Even though I think you probably have enough breast milk to just sort of do okay, we've got to flush this bilirubin out so that we avoid the dangers of long-term high bilirubin. Yeah, I know. I wish it was better news, but hey, it's gonna work. You got it down before, you can get it down again, and we'll check you again in a couple days. All right.
Well, I hope you enjoyed this presentation.